Good afternoon. My name is Katie Terrell, and I'm so excited to be here with you again today. Welcome back to Transformation Thursdays, where we highlight some of our agency's powerful work here in Northeast Louisiana. I am responsible for leading our special initiatives here at Northeast Delta Human Services Authority, and I have the privilege of working pretty closely with our integrated care department. I'm so happy to have an opportunity to showcase their work on today's episode. So, our mission at Northeast Delta is to serve as a catalyst for individuals with mental health, developmental disabilities, and addictive disorders to help them realize their full human potential by offering quality, excellent care with greater accessibility. Our vision is to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. The three tenets that guide our actions are greater access to services, excellent customer service, and quality, competent care. It is Thursday, July 10th, 2025. On today's episode, we are going to highlight our agency's integrated care services, as well as our pharmacy partner, Genoa Healthcare. Whether you are already a client of ours or you're wondering if our services are right for you, you are in the right place today. We are so lucky to have both Janice Rogers and Dr. Brandon Demerson here with us on Transformation Thursday today. Janice is our Director of Integrated Care here at Northeast Delta HSA, and Brandon is the Director of Operations for Genoa Healthcare, the pharmacy provider for Northeast Delta HSA. Welcome, Ms. Rogers and Dr. Demerson.
Good afternoon.
Good afternoon. Thank you so very much.
So thank
Ms.
y'all
Terrell.
both so much for joining us today. We are so excited to jump in and get to know a little bit more about what you guys are doing. So, Mrs. Rogers, can you give us an overview of what integrated care is?
For sure, I can absolutely do that. So integrated care is a holistic approach to health that recognizes the deep connection between a person's physical, mental, and behavioral health. At Northeast Delta, we don't see these as separate systems. We believe that they all come together to make the whole person whole, and we understand that someone who may be managing a chronic medical condition may also be facing some type of depression and or anxiety. Pardon me, that noise just threw me off a little bit. Or that someone dealing with substance use disorder might also need help dealing with maybe diabetes or high blood pressure. So we really want to make sure we are taking a look at the entire person and be able to bring an array of services that wraps around that individual in a way that's really coordinated. It's compassionate, it's comprehensive, so that the individual can get what they need when they need it. Now, there are several components to integrated care. One is being person-centered. It's really working to empower the individual by focusing on their needs, their preferences, and their values. Overall, really helping to make sure we bring them into the fold, educating them about the services that they are able to receive, and also, just working on what they need, what their needs truly are. Another component is collaboration. Really working to bring together different healthcare professionals, caregivers, educators, different community partners that we work with, like Genoa Healthcare Pharmacy. Then another is continuity of care, ensuring that there are transitions, very seamless transitions across any agencies that may be working with the individual, or any long-term support that they may need. And then another component is accessibility, ensuring that the services are accessible and equitable for everyone that we're engaging, or anyone across our region, honestly. It's really about taking care of the whole person, understanding their needs, and going the extra mile to ask questions that will truly ultimately make a difference for the person.
Yes, I think that's so important. I know that we can all probably relate to times where we've gone to the doctor or gone and seen a mental health professional or someone in that arena, and they don't know anything about our history, and they don't know anything about the other things that might be going on that might be affecting those things. Because as we know, primary care and mental health, and addiction, they kind of can run hand in hand. And so that's so awesome that those services are there to ask those questions and to be intentional about being more holistic. So, Ms. Rogers, can you tell us a little bit about
Most
the
definitely, yes.
Sorry, there was a little bit of a delay. I probably talked over you. So tell us a little bit about what all are the services at Northeast Delta HSA that fall under integrated care? Because that sounds like a very big umbrella. So what are the services?
It is a big umbrella, but we do try to make sure, like I said, it's very seamless. Under our integrated care system, we provide a small bit of primary care that really works with any comorbidities that an individual may have that's tied back to a mental health diagnosis. We also provide substance use treatment, and that particular service can include varying different types of addictions, including like opioid disorder, alcohol disorder, tobacco cessation even, or someone who struggles with problem gambling. We do have individuals that are able to provide those services. Also underneath our umbrella is prevention and wellness services, developmental disability supports. Genoa, as you know, is here today to speak as well. Care coordination. We also provide access to peer support services, inpatient substance abuse treatment as well, and then a bunch of other services that really work to address any social determinants of health like housing, transportation, and also food insecurity. Our goal is to work to break down silos that really that will help make sure care is seamless, person-centered, and accessible. We utilize this integrated system approach where we bring different partners together. We utilize memorandums of understandings that really help to bring about successful outcomes to any individual that comes into our clinic for services.
Absolutely. That's wonderful. And I know that even internally, we try to do such a good job of interacting between departments because, as Janice mentioned, and you might have heard last week, we have a big developmental disabilities team. We have a big prevention and wellness team. And so it's so important on our end to have that collaboration internally as well. So if someone is interested in our integrated care services, what is the first step to accessing those services?
Yes, Katie. The first step is to simply reach out. The individual can call our clinics. Our number is 1-800-256-2522. Or they can locate the clinic that's closest to their home or to their residence. They can also visit our website as well to go in and research any services that we offer before even calling the clinics. They can also send an email via our website that is sent directly to myself, and I'm able to share that with our clinic staff and have someone to reach out to them directly. Once we get the ball rolling there, our team will complete a comprehensive assessment to really work to understand the individual's needs, and then we'll be able to connect them with a mix of services that are the right fit for them. Whether they're looking for counseling, substance use support, or any combination of those services, we'll be able to build a care plan that really works to meet them where they are.
Yes, thank you so much, Janice. I think sometimes whenever you're overwhelmed and you feel like you could benefit from services, but it's like, how do I take that first step? And I think just as you described, what we want people to know is that it's just making that first contact. It can be by phone. It can be, if you don't like talking on the phone, it can be on the website. If you would rather be in person, it's walking into a clinic. But making that first contact is so important. So, and it shouldn't be difficult. We want to make that a seamless process, as you've said. So
Most
now, and I
definitely.
know,
Thank you.
of course, so something that's so important when we're talking about healthcare and mental health and addiction and primary care is having a trusted, accessible pharmacy to be able to partner with. And we are so lucky that we have Genoa Pharmacy to partner with us and be even on site at our Monroe clinic. So, Dr. Demerson, can you tell us a little bit more about Genoa Healthcare and pharmacy?
Sure, Katie. So this partnership between Genoa Healthcare and Northeast Delta started almost coming up on 4 years ago. And we've been able to be there on site in the Monroe location to provide customized patient care for those with complex conditions. So those that, we specialize in behavioral health, but we do also support those living with more complex conditions like substance use disorder or HIV, some of the conditions that Ms. Rogers has spoke to earlier. So our pharmacy, while we do specialize in those conditions, we are a full service pharmacy and we can fill for all meds. We are a people service pharmacy. We offer a high touch, compassionate care. We know that with many of these conditions that our consumers and our patients that are living with these conditions, we know that it's very important that we provide a stigma free environment for them to come to the pharmacy, receive medication, and a high level of service and care to be able to allow them to live with the conditions that we are working to try to help them manage and treat. We specialize in being able to meet those patients where they're at. So obviously we're there on site in Monroe, but if there's an opportunity with transportation, we can mail to the patient's resident or address, or even if they're living in an assisted living facility, we are able to offer those type of services and be able to meet those patients where they're at.
Awesome. Yeah, I think when it comes to a pharmacy, being accessible is so important, and then that customer service is so important, and we feel so lucky to have y'all there with us through that. So, why is it so important for Genoa to partner with Northeast Delta? I mean, you guys could have your own facility separate from, and you do have other facilities, but you guys chose to have one in the clinic with us. Why is that so important?
Yes, that's very important when we think about the continuity of care that Ms. Rogers has spoke to. So us being right there present in the building allows us to be able to collaborate right there with the patients, but also the providers on the best course of care for that patient. So we are able to collaborate with the providers around maybe different medication options, different therapies to maybe consider. If there's issues or barriers to the insurance that maybe is not formulary on the patient's insurance, or working with the provider or the patient to provide medication that might be more affordable for those consumers or patients, that's what we're there for. We are also able to make sure that the patient is adherent to those medications. We do refill reminder calls and we follow up frequently with those patients when their refills are due or when they're out of refills. And we're able to communicate those adherence patterns with those patients to those providers. So if there's a patient that may be struggling with certain meds or maybe not being consistent with their medication, we are right there to collaborate with the provider. It's an easy process and are able to drive quicker and more efficient, healthier outcomes for those patients.
That's so awesome. Yeah, I think a lot of times doctors and providers and pharmacies feel so separate, and it takes a while to get a prescription sent. It takes a while to get a prescription refilled, and there's not much communication. So it's so wonderful to hear that y'all are collaborating and that it is such a patient-centered approach. So, and I know we've been talking a lot about the physical pharmacy, right? But I know that we're partnering on a couple of exciting initiatives that are coming up soon too that aren't necessarily about the physical pharmacy. Can you talk a little bit more about those?
Absolutely. So as a company, every over the past few years or the past couple of years, we've been able to offer vaccinations, flu vaccinations, and COVID vaccinations through our health equity initiative as a company that offers those vaccinations at no charge to those that are uninsured. So we know we're coming up in that fall and cold and flu season. So definitely stop by the pharmacy to get your flu vaccination. And then also we've been able to partner with Northeast Delta more recently on servicing and providing vaccinations for the developmental disability community and homes that they partner with as well. So we're looking forward to participating with that again. And then within the pharmacy and within the clinic, there's different initiatives and things that we celebrate monthly as well, and we have different giveaways to coincide with maybe the events that we're running for the month. And we run an art contest as well, and I know Northeast Delta does an art contest as well with the patients, and it's really exciting to see how creative our patients and our consumers are, even with some of the conditions that they're living are with. They're very talented, and it's an opportunity for them to celebrate and showcase their art. So that is also initiatives that we have going on within Genoa and Northeast Delta.
That's wonderful. Yeah, you probably have heard, Dr. Demerson, that we have this whole art as medicine initiative, and how we just feel like art can be so powerful. And so it's great that y'all are doing that as well. I think that it's something that, sometimes can go outside of the medical, practice, and really get people more involved with us and with y'all, and with even just talking about mental health and addiction in a different way. So love that you guys are doing that also. So yeah, and I know, and we had, Amy from Developmental Disabilities last week or a couple weeks ago talking about those vaccination clinics. And I know that we look forward to that every year, and with y'all's partnership, being able to go out and provide that to a lot of our developmental disabilities clients. And we're just so appreciative to be able to do that. So thank you so much, Dr. Demerson, for sharing some of those thoughts.
No problem.
So thank you so much to Janice and Brandon for being on Transformation Thursday today. So if you're watching, I know we just gave quite a bit of information on this episode. Janice shared a lot of really important, great information. And then Brandon also shared so much about the pharmacy side of our integrated care services. If you want more information about anything that we discussed today, please visit our website at nedeltahsa.org, or call us at 800-256-2522. Thank you so much for tuning in today, and thank you again to our wonderful guests, Ms. Janice Rogers and Dr. Brandon Demerson. I encourage you to follow us by following the Phoenix on social media through Facebook, YouTube, Instagram, LinkedIn, X, and TikTok. Basically, you can find us anywhere, and it's NE-Delta HSA. So we encourage you to go be great today, and we will see you next time. Thank you.